This is a presentation about the 6-minute walk test. This test assesses the distance walked over 6 minutes as a submaximal test of aerobic capacity and endurance. The test assesses the activity portion of the ICF. It is a quantitative performance-based test and it is measured by distance. The 6-minute walk test is used for a variety of populations, primarily COPD. This presentation will focus on COPD, heart failure, and stroke. It is used before and after treatment to compare, to measure functional status, and to predict hospitalization and death. If there is a history of unstable angina or heart attack during previous months, this test should not be used. Also, resting tachycardia and uncontrolled hypertension are relative contraindications of this test. Normally, the test is done indoors, but it can be done outdoors as well, with a walking course of 30 meters, and the course is marked every 3 meters. There also will be a turnaround point with a cone. Patients should be wearing comfortable clothing and they are able to use their normal assistive devices. Before the test, the therapist should measure the patient's blood pressure, pulse, and baseline dyspnea, and overall fatigue using the Borg scale. Give the patient strict instructions and only say specific phrases, which are demonstrated in the video following.
The object of this test is to walk as far as possible for 6 minutes. You will walk back and forth in this hallway. 6 minutes is a long time to walk, so you will be exerting yourself. You will probably get out of breath or become exhausted. You are permitted to slow down, to stop, or to rest as necessary. You may lean against the wall while resting, but resume walking as soon as possible. You will walk back and forth around the cones. You should pivot briskly around the cones and continue back the other way without hesitation. Now I'm going to show you. Please watch the way I turn without hesitation. Are you ready to do that? I'm going to use this counter to keep track of the number of laps you complete. I will click it each time you turn around at the starting line. Remember, the object is to walk as far as possible for 6 minutes, but don't run or jog. Start now or whenever you are ready. You are doing well. You have 5 minutes to go. What, if anything, kept you from walking farther?
My legs hurt.
Please grade your level of shortness of breath using this scale.
I would say 4.
Okay, somewhat severe. And please grade your level of fatigue now using this scale.
I'd say a 7.
Okay, very severe. Okay, congratulations on walking. I'll get you some water.
Thank you.
The first patient population we'll look at are those with COPD. COPD is a systemic disease characterized by progressive airflow limitation, decreased exercise tolerance, and physical inactivity. The test for this population, as well as others, is used to assess functional exercise capacity before and after interventions. In examining the rigor of the 6-minute walk test in those with COPD, we found the ICC, determined by a test-retest method, to be 0.93, with a 7% increase between tests, suggesting that a learning effect may be present. The specificity of the test was 0.77 with a sensitivity of 0.08. Criterion validity showed that there is an adequate correlation with length of hospital stay between pre-surgical 6-minute walk test and post-surgical 6-minute walk test. The MDC is the minimum amount of change in a patient's score that ensures the change isn't the result of measurement error. 54 meters has long stood as the MDC as calculated by Riedelmeier in 1997. Newer studies, however, using a larger sample pool and different approaches, have calculated the MDC as being about 35 meters. The MCID is the smallest amount of change that can be detected by a measure that corresponds with a notable change in ability. For those with COPD, this distance has been found to be 54 meters. With this amount of change, the patient is said to perceive a change in their function that they deem important. However, it is important to note that this was determined using subjective comparisons by the patients. It is also noted that a distance of less than 350 meters has been linked to an increased mortality. The second patient population we want to talk about are those with heart failure. Heart failure is a progressive condition where the heart muscle is not able to pump enough blood to meet the body's needs for blood and oxygen. For those with heart failure, the 6-minute walk test provides information that may be a good index of the patient's ability to perform daily activities. Looking at the stats of the 6-minute walk test in association with heart failure patients, we see the ICC as being between 0.88 and 0.91. This was calculated over a longer period of time to hopefully negate any learning effect. In analyzing its content validity, the test is strongly correlated to peak VO2 with a correlation of 0.788. The specificity and sensitivity of the test are 0.83 and 0.80 respectively. The MCD and MCID for the heart failure patients is that of 32 meters for the MCD and 30 meters for the MCID. It is important to note that the MCD and MCID were found using a convenient sample of only 22 participants. This small sample size may draw into question the generalizability of these values. Lastly, the stroke patient population is another group that the 6-minute walk test can be used for. Similar to all the other populations, the 6-minute walk test is used to determine functional change within this population. Several kinds of validity have a strong correlation with the 6-minute walk test. Criterion validity showed that in stroke patients, the 6-minute walk test had a negative correlation with the timed up and go, with a correlation of negative 0.89. Meaning that as the timed up and go score decreased, the distance traveled in the 6-minute walk test increased. Content validity also showed strong correlation with other tests as well, such as the correlation of 0.89 with gait speed and 0.69 for FIM locomotion. The test-retest reliability with this population was excellent, with an ICC of 0.97 to 0.99. Unfortunately, the specificity and sensitivity are not well researched for this patient population, indicating a need for further research. The MCD for this population was found to be 51 meters, with an MCID of 50 meters. These two values were determined in separate studies, and differences in sample size and characteristics may result in some error. Overall, we believe that the 6-minute walk test is a great outcome measure to use with a variety of patients, with its ease of administrating and its strong reliability. While no value has been set, it is understood that a floor and ceiling effect may be present, which could decrease the usefulness of the 6-minute walk test in certain populations. This has been a presentation on the 6-minute walk test by Amy Essenprice, Casey Nooner, Emily Watkins, Samantha Cruz, and Zach Boyle.